We are back on MorningLine. Thanks for joining us. Our guest this morning, we are joined by malpractice attorney extraordinaire Clint Kelly from his office there in Hendersonville. Good morning to you, Clint. And listen, we've got Joe, who always likes to jump in first with a question for you. You know him. He's a loyal follower of the show. And Joe, good morning. What's on your mind, my friend?
I just wanted to ask Mr. Kelly, it's kind of a hypothetical situation. Say you went to a dentist to have your teeth cleaned, or you went to your doctor just for an annual checkup or whatever, and you came down with COVID. Would you have a case? And I'll just throw this in. I'm very familiar with arbitration, and Mr. Kelly explained it very well. Arbitrators are supposed to be unbiased towards either side, either who you're suing or the person that's doing the suing. So arbitration sometimes turns out real well, and these arbitrators have seen, most of them have seen a lot of cases, so they're very good at what they do.
Clint, you've actually said in the past there are some who figure, that clause that folks sign, they'd like to take it out because arbitrators sometimes come back with a better result. As you've made the point, juries sometimes are loath to give money to these plaintiffs as much as arbitrators, right? So arbitrators sometimes could be better than a jury trial.
These days, Nick, I would rather have an arbitrator decide medical malpractice cases than I would a jury.
Interesting.
Not all cases, but in many, because, well, for all the reasons we've discussed, you and I, for years, it's tough to win these cases with a jury. It's just the day and time we live in. And getting back to Joe's question, it's not just the juries, it's the legislature, because as you know, back in August, when they had the special session, they passed the COVID immunity bill, so now law. So for a situation like Joe described, if you caught COVID in a dental office, it is close to impossible to win that case, because the legal standard for holding the healthcare provider liable for catching COVID is so high that it's virtually impossible to beat. So the answer to Joe's question is probably no.
Can you give me a scenario, and I agree with you with what we've seen, but maybe, for instance, how you handle it. All right, so let's say, at what point, do you go once a year, twice a year to get your teeth cleaned? I do. Mine has been put off now till January because, dentists' offices have really shut down except for emergency practices in a lot of areas. But what do you do? Are you going now? Because, of course, they say dentists, more than a lot of doctors, it's more dangerous because when they're cleaning, there's a mist of, moisture coming out of someone's mouth, which is about as bad as it gets. How do you handle it?
Well, yeah, I went during the summer, but of course that was back when COVID seemed more in control. If you remember in June, things were looking pretty good. Now, I haven't been since then, so now I don't know what the situation is. I just heard the other day that Vanderbilt was putting their elective procedures at the bottom of the pile to accommodate the COVID patients that they've got. So we're right back where we started from. Yep. Seems like where we were in March and April with this surge that we're in. I'll tell you this, Nick, just from a practical standpoint, I had a friend of mine, we were going to have a dinner celebrating an anniversary for his wife, and we canceled it because of the COVID situation. I don't know that I'd want to be around a bar or a restaurant that has a bar. I don't think I'd want to be in a dentist office right now. I just think, given the situation we're in right now, it's just like March, and although we know more and we can try to be more careful, last thing I want to do is wind up in a hospital sick right now with the census of COVID patients that are in these hospitals.
What's interesting about it is all the talk, of course, appropriately enough, is about COVID patients. But against this backdrop, Clint, there are still the patients out there that are dealing with a myriad of other conditions that have always been going into hospitals, even before COVID, of course, whether it's joint replacement, heart surgery, brain surgery, whatever it is, appendicitis. I just wonder about people like that who get sick right now against this backdrop about COVID. What kind of concerns do they have? Of course, you have no choice. If you have appendicitis, you got to have it taken care of. That's not an elective procedure. They're doing these types of things. I had a friend of mine recently whose son was very badly burned in an incident on the hand and had to go to the hospital, and which they did, and it was cared for. But I'm just wondering, it just seems like from the news that, the medical facilities are just staffed completely with COVID. What about everyone else?
Yeah. If you remember when this started, I told you what I thought the chief concern would be the patients who aren't COVID infected, who need help, are going to be put in the back seat to the patients who have COVID. And some people, because of that, are going to have a bad outcome that could have been or should have been prevented. And I think that's still the situation now. I think when all this shakes out, probably sometime into this year, beginning of next year, when we start finding out more about these hospitalizations, I think I'm going to get calls from patients or their families who had a bad outcome. And we're going to find out because the care they were supposed to get was put elsewhere, or they were, as I said, sidelined because of the COVID census. And in some cases, I have some sympathy for the hospitals for that. Mm-hmm. And that's going to be where how's it going to shake out? Depends on obviously the facts and how things look. But that's why I would not want to be in a hospital right now, for not only for COVID, but for anything else if I could avoid it, because I'm afraid it's just going to be a nest of bad outcomes.
Yeah, well, I'll say this. It's interesting. You're right, especially now. But Clint, one thing I've learned from you always, hospitals are sick places by definition. And if you can avoid a hospital, you should, because it's just the way it is. And that was even before COVID, right, Clint?
Absolutely. Yeah. I mean, they're dirty places. Yeah. That's the way it is.
Yeah, germ-wise. Let's take a call from Michael for you. Michael, good morning. Hi, Mike.
Yes, Nick, I'd like to ask him a question.
Sure.
What if you have now he says it's hard to sue these places, but what if you have COPD, high blood pressure, you're diabetic, and you have sarcoidosis, which is a rare lung disease, and you are made to come to a hospital setting to see a doctor to receive medications that you have to have each month. And they used to do the phone visits, now they refuse to do those. And I have to go in every month, once a month, into a hospital setting where people coming from the emergency rooms, just walking around and things, and I'm put in that situation. What can I do?
Yeah, that's terrifying, because your point is you are probably, if you were to get COVID, among the very highest risk because of those. Yeah, you would die. By the way, when you do go, I would imagine, you're bundled up and you're wearing your mask and keeping your separation as best you can, right?
Yes, sir. Yes, sir. But like I say, the room where they have you wait is very small. It accommodates maybe 15 to 20 people at a time. Yep. And usually there's 7 to 8, 10 people in there. And keeping your distance is as best you can. You're still sometimes called to counter where you're with the arm reach of people.
Sure. All right. Yeah.
Like I said, I just don't understand what to do to get them back to the phone, visits and things like that, because I'm so high risk. Well, even my doctor has told them.
Okay, I'll let Clint answer that. But real quick, why did they cut off your telemed? I mean, that seems like they just need to talk to you and give you the prescription.
But they say it's the law that I have to come in, because it's a pain clinic, and it's the law that I have to come in once a month to do this.
Okay.
And I've been on the medication for years.
Gotcha. Clint, what do you think?
I don't know why they're not mailing medication out to people, but that's a separate issue.
Yeah.
He's raised two things. The first issue has to do with the accommodations that can be made for him to protect him, and that's beyond my realm of expertise. I'm not an expert in that. What I do have some expertise in is the law, and in particular, what are his rights if he gets infected. And if you'll recall, back in August, I was screaming from the rooftops to anyone who would listen to call their legislator and try to stop the COVID liability immunity bill, because I knew that people were going to get sick, and they were going to get sick due to negligence, and they're not going to get their day in court. And it's just, unfortunately, people have their things go on in their lives and they're just not tuned in to what the legislature does when the legislature is trying to steal your rights. And that's what they did here. And so for people like Michael and others who get sick, they're just not going to have a legal remedy. 99% of them. There may be that 1% case where you find an exception or the conduct is so horrible that you can skip by and get over the burden requirements. But for the 99% of them, you're not going to get your day in court. You're just going to have to deal with it.
Wow. All right. Let's go next to Jackie. Jackie, good morning. Hi, Jackie.
Good morning.
Go ahead, ma'am.
Yes, I had a surgery 8 years ago on my spine. It was a butcher. He butchered me. I lived in the physical therapy for about 8 months, learning how to walk again, and still cannot walk or stand, for any length of time. And ever since surgery, I've been having all these bladder infections and having to wear catheters and been to doctor after doctor and test after test. And they finally figured out that in all the nerve damage that he'd done during the surgery, he also damaged the nerve that receives from the brain that tells my bladder to empty all the way. So now I'm going to have an implant put in for the rest of my life and carry around a remote control. So my brain will get the signal. And I'm sure there's nothing I can do, but I just thought I would ask. It never hurts to ask.
No, sure. Thank you for calling, and I'm so sorry you're going through that. And Clint, the problem here, of course, and we haven't touched on it, this surgery was 8 years ago, and there's a statute of limitation of 1 year, as we know. But she seems, what if you have a surgery like that, and the ill effects of it are not discovered or manifest themselves until a few years later? Is there any chance of a case there?
No.
Okay.
Because the ill effects were manifesting themselves at some point after 3 years. You've got two statutes that are involved. The first one, which is the one we're all familiar with, which is you've got to take some action within 1 year that you discover you've been harmed. But if it goes beyond 3 years, absent fraud or absent a foreign object being left in your body, you're barred.
Okay.
So when she said 8 years, that's when I knew that she was not going to ever get her day in court. And that's what's unfortunate is I didn't get a chance to ask her why she didn't at least call a lawyer back then. Maybe she did.
Let me ask her real quick. She's right here. Let's just see. Jackie, I'm just curious. Is there a reason you didn't call a lawyer back 8 years ago?
I didn't know anything about the limitations, first of all. It's too short for one thing, but I was trying to learn how to walk.
Yeah, you were busy with that, but did you have a suspicion right after the surgery that they did something wrong?
Oh yes, every physical therapist, every doctor that ever saw me said I should never be in that shape. Their words were I was butchered.
Wow. Yeah, see that, Clint, I think you and I can both relate to the fact that this poor woman's coming out of this, and there's a lot going on. The average lay individual doesn't know malpractice the way you and I do. I've learned it all from you, and she's busy learning how to walk again, and so maybe that's not forefront of her mind. That's maybe where a family member comes in and says, Mom, Dad, maybe we should look into this, because I understand where her focus was.
Yeah, and she's correct. It is too short. We've tried to extend it. The legislature won't hear about it. Neither will the doctors lobby. They just insist on maintaining that 1 year statute of limitations and the 3 year statute of repose. And so they're going to be the Jackies of the world who are more interested in getting better than they are suing. And their heart's in the right place and they've got the right attitude. But when the full weight of the injury reveals itself, then they figure they've done everything they can do and they have to turn to the legal system. The legal system shuts the door on them. And unfortunately, that's not going to change anytime soon.
Yeah, you're absolutely right, and I feel for you, Jackie, because I don't know all the details. And if this had just happened 6 months ago, I can guarantee you Clint would look into it. And it sounds like you may well have had a potential case here because all the experts said that you were, quote, butchered. But now, regardless, it's a moot point. It's a lesson for everyone else to pay attention to. Listen, Clint, we need to take a quick break. When we come back, more of our conversation with malpractice attorney Clint Kelly right after this.